July is Minority Mental Health Month, and joining us now to talk about how the mental health crisis in the U.S. is affecting people in minority populations specifically is the clinical director at the Rose Hill Center. Shawn Bryson joins us now on the Michigan Megacast. Shawn, thank you for joining us today.
Thank you for having me.
Appreciate having you on the show to talk about this, because over the last couple of years, particularly with the COVID-19 pandemic, we've seen a reduction in the stigma against mental health conditions, and people have been more open to talk about mental health. But what we often don't do is zoom in on that issue and understand how different populations and their mental health situation, their mental health conditions, things that affect their mental health and take a toll on their mental health, we don't really take and put those under the microscope so much. So for Minority Mental Health Month, what are some of the primary focuses for minority populations in terms of their mental health that maybe aren't being looked at as closely as they should be in our society today?
I think one of the things that we need to look at are our youth and the children. Most 75% of the young people that are in any kind of incarcerated situation have mental health issues, but often that population is highly represented by Black and Indigenous people of color that are in the jails, and they are not being addressed earlier when they are showing the signs of those mental health challenges. Instead of being referred for mental health care, for outpatient treatment and or specialty clinics, they are often misrepresented as behavioral problems and antisocial behavior, and incarcerated or in some type of locked facility or punishment mode rather than treatment facility.
And especially when,
I'm sorry.
Please continue.
I was just going to say that, especially with youth, I mean, that's one of the big areas where we see quite a disparity in the care that's necessary for those folks.
So what sort of interventions are needed particularly in minority communities, in Black, Indigenous, and person of color communities, where these certain services that would be critical in preventing some of these issues, or at least keeping kids out of juvenile detention centers or out of having a record going into their adult life? What are some of those key interventions that aren't there right now, but would be really useful in these communities?
I think resources just in general, that we know that public mental health services are very limited in general for the general population, but certainly in minority communities. We have taken social workers and counselors out of the schools. Their primary focus now is just to take care of the paperwork requirements for the school, and less about actually working with students and their families, making interventions at an early on point. In addition to outpatient services for adults as well. Being able to see or have access to a psychiatrist and a therapist can sometimes be a wonderful intervention that has maximum impact with minimal intervention, I guess, in that sense, opposed to like a residential setting or some type of hospitalization. It can help individuals manage the challenges that they're experiencing, whether it be depression or anxiety or thought and mood disorders as well. So having greater access to those resources in the communities that people live in, I think would be a very well needed and helpful addition. In also with being able to allow people to work with professionals that look like them, that come from areas that they come from, that the individual can feel comfortable talking to.
So let's talk about that, and let's expand on that on the professional side of mental health. What in terms of what colleges and universities, and certainly what organizations that are involved in the mental health community of medicine. What further efforts do they need to do to be able to make those strides and bring more people into those professions that are from Black, Indigenous, and person of color communities, so that we can properly treat people in those communities in ways that are culturally competent and are trauma informed for what they're going through?
I think I believe that the cost of education is a barrier. Often, in order to be prepared as one would need to be helpful in the communities, you need to have an advanced degree. An advanced degree, even at one of our local universities, can run upwards to $80,000, $90,000, depending on whether or not you stay on campus. For someone to invest that amount of money for the proper training, and then the salaries that are associated with those positions, often people decide to choose other careers if they're going to make that kind of an investment. So being able to make education and training available at a more affordable rate. And there are some programs out there that do help with some loan forgiveness and help with people being able to get the training that they need, but not straddled with a lifetime of debt and their efforts to obtain that.
We're joined by Shawn Bryson, the newly appointed Clinical Director of the Rose Hill Center, joining us on the Michigan Megacast. You can find more information on the Rose Hill Center by visiting rosehillcenter.org. That is rosehillcenter.org. And Shawn, as the new Clinical Director at the Rose Hill Center, how are you incorporating some of these principles into the treatment operations and the clinical operations at the Rose Hill Center to be able to provide an even greater level of health care than was already being provided by the center?
Well, one of the things that I strongly believe in is continued education as well. Our clinicians here certainly come well prepared and with advanced degrees. But we continue with that education process with additional conferences, seminars, and trainings, opportunities for people to grow, to learn new evidence-based practices so that we are giving the individuals that we serve here at Rose Hill the most comprehensive care available to our field.
We're joined by Shawn Bryson, the Clinical Director at the Rose Hill Center on the Michigan Megacast. If you're just tuning in, you can view this full interview on demand, as well as all of our interviews on demand at civiccentertv.com by visiting our Megacast link. civiccentertv.com/Megacast are usually up there sometime mid to late afternoon. And of course, we're talking to Shawn as this is July, and July is Minority Mental Health Month. As we continue to battle through a mental health crisis in the U.S., it's definitely something that's become much more recognizable and much more and much less stigmatized across the U.S. Going back into that, Shawn, as we look at what's going on in the world too, and we've talked to psychologists and to social workers in the past on this program about the impact of social media, on the impact certainly of current events on the mental health of individuals in our community. As we think about 2020 especially, but also some of the hateful rhetoric that we're seeing, that we continue to see, particularly in the political realm in the U.S. at this time, what sort of impact, even beyond the general mental health situation in minority communities, is that having, compounding onto those issues and further putting stress on the mental health of our minority communities?
Certainly the level of anger, I would say, and hatred that is easily communicated through social media formats have a large impact on communities of color in that it is traumatizing to hear and see these things in present day, to feel as though with the activities that happened in January of last year, that 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 we would be able to not feel safe in our own communities, concerns about violence and other things that are, negative that just add to the stress, the anxiety, and depressive symptoms that are already in existence with the existing issues that they deal with day to day. And having that come on top of it just compounds the challenges.
We're joined by Shawn Bryson, the clinical director at the Rose Hill Center, joining us on the Michigan Megacast. More information on the Rose Hill Center can be found at rosehillcenter.org, rosehillcenter.org for more information. And just to put this into context, Shawn, in Black, Indigenous, people of color communities and communities of color, just how much of an issue is our mental health concerns, just how broad in those communities are mental health issues, whether it be depression or anxiety or some other even more severe cases as well.
How prevalent is that in the community? Is that what you're asking?
Yeah, across the board in minority communities at this moment in our history.
There's significant, based on some, data that I've reviewed, that there is significant mental health issues in Black, Indigenous, and people of color communities because while they represent a smaller number or percentage of individuals challenged with mental health issues, they're the number of people that seek treatment for that care calls for a wide disparity in care. They are not getting the care that's necessary, and therefore it continues to go without treatment. It affects other people in the community, children, families, and exacerbates and can, as I mentioned earlier, become more severe and result in hospitalization and additional challenges, loss of employment, severed relationships, and all those things that go along with untreated conditions. And so once you have such a large presence in a community and it's either inadequately or poorly cared for or treated, it has that ripple effect in a negative way.
All the more reason to put a focus on mental health in minority communities, not only in July, which is Minority Mental Health Month, but all throughout the year as well, and continue to make critical changes in our community. Shawn, just another minute or so before we'll need to say goodbye today. Anything else we haven't discussed that would be important for our audience to be considering in terms of health, mental health in our minority communities here in Michigan?
I think that it's important for folks to know that there are resources out there, even though there may be some limitations to that, but there are resources available, and you can always start with your local mental health association, whatever community that you're in, to just look for a community mental health. You can do a search on the computer, and they will direct you from there. If they can't provide the service for you, they will give you alternatives and move you in the right direction.
Shawn, thank you so much for your insight, for giving us some context on issues of mental health in communities of color, and congratulations on your position with the Rose Hill Center as the new clinical director.
Thank you.